Hi, this is Liz Abadiotakis, occupational therapist, and this quick video is just to help understand the senses. The 5 basic senses are sight or vision, hearing or your auditory sense, touch or your tactile sense, taste or gustatory, smell or olfactory sense. I'd like you to think about your preferences and also any concerns you may have as we go through each sense. Sight, your sense of vision, could mean multiple things. It could mean the way your eye sees acuity-wise, so whether or not you need to wear glasses to make either your near or far vision more clear. It can also mean visual perception, so how your brain is understanding the information, the visual information coming in. Hearing or auditory information comes into the brain obviously through the ears. When we think about that, we can think about our preferences for what types of sounds we like to hear, if we're sensitive to sound or if we like loud noises. Also, we think about filtering when we talk about hearing. So are we able to filter out extraneous noises and really focus in and tune into important information, such as a teacher talking? The next one is touch or tactile. So when we talk about this system, we're talking about our sense of light touch. So do we like light touch or do we avoid light touch? Are we the type of person who doesn't like tags in our shirts, or are we not really bothered by that? Do you prefer tight clothing versus loose-fitting clothing? Do you like getting messy, touching things like glue or slime, or are those things that you avoid? So those are all things that come into play when we're talking about that tactile system. Next is taste or gustatory. So we're talking about, again, preferences and what we seek out taste-wise and what we may avoid taste-wise with regards to food, typically. Are you somebody that looks for really spicy food or enjoys spicy food, or are you someone that really prefers more bland or soft foods? Next is your sense of smell, which obviously is connected closely to taste. So are you someone that is sensitive to smell, in a room? I know that certain people can't handle being maybe in cafeterias and things because there's too much going on smell-wise, and it can become overwhelming or disorienting. So, and some smells obviously can be very pleasant and can be very calming to us. 2 additional senses that we talk about is the proprioceptive sense and also the vestibular sense. So these are the ones that are often not heard of, or there may not be as good of an understanding, I guess, in the general public. So we're going to talk a little bit about proprioceptive sense, and that's your sense of body awareness. So typically I will ask people to try to close your eyes and take your 2 index fingers, and I want you to try to bring them up over your head and touch them together, obviously without looking. This is our sense of body awareness. How do we know how much force to exert? How do we know how far to move our hands? We have really good joint awareness to be able, and muscle awareness to be able to figure out how far, how close, and also how much force we're exerting in order to perform a motor action. So that's our proprioceptive sense. Also, our vestibular sense is the next sense that we don't often hear about, but that's our sense of movement, or where our body is in relation to our environment. So, if we are standing up and we close our eyes and even stand on one foot, how do we know that our body is still in an upright position? So the vestibular system is closely connected to the inner ear. We have 3 semicircular canals in our inner ear, and there's fluid in those canals and small receptors in those canals. So each time that fluid moves, it gives our brain feedback about where we are in relationship to the environment. So I'll often describe this inner ear fluid, I relate it to a cup of water. So if you imagine walking down a hallway holding a cup of water, the water may have slight vibration, and that is enough information basically to allow our bodies to understand that we're upright and that we're moving in a linear pattern walking forward. Now if we were to start spinning around, that cup of water would also start spinning around, and that would give us a higher intensity of information about how our body is moving, and in what direction, obviously around. So that's a quick description of all of the 7 senses that we like to talk about when we're discussing students' needs. The final slide, I'm just going to discuss the relationship between sensory and motor. So I'm going to read this here to you. So sensory motor skills are the ability to use incoming sensory information from those 5 basic senses that we talked about, as well as our proprioceptive sense and our vestibular sense, in order to produce an adapted motor response to that information. So, we're thinking about if we're sitting in a classroom, we're going to have some visual information of light, and also any information that's maybe written on the board from a teacher. We are also going to have our auditory sense acting by trying to listen or filter out extraneous noises and tune into the teacher. We're also going to be using potentially our sense of touch if we're touching materials or paper. If there are smells in the room, that might play into it. We also are going to be using our proprioceptive sense to know how we are moving our hands to write or cut or participate in the classroom activity. And we're also going to be using our vestibular sense to maintain a level of alertness and be able to sit up tall in our chairs. So that's kind of how all of this plays out. We're getting in information from the environment, and then hopefully we're able to sit and attend well to the activities that are being presented to us. I hope that was helpful in better understanding how the senses work and just the basics. If you have more specific questions, you can certainly contact your student's occupational therapist, and they can give you more specific information regarding your student's concerns. Okay, thanks so much.